تمام؟ طيب بسم الله. طيب hello everyone, welcome to this session. We'll be revising speed running through your radiology lectures throughout the content. Inshallah يعني we'll be explaining everything, even stuff يعني you're yet to take. بس خلاص this will be a comprehensive lecture inshallah. Okay, I'll be explaining GIT, Rashid will be explaining renal and reproductive. طيب for GIT, in this year you guys took only one lecture and Dr. Rami only explained 70% of it. Last year we took 2 lectures at the time. What I found out is that the second lecture كان يعطيها دكتور عبيدين على سنتنا. نعطيت لكم بالأوسكي. كان في أوسكي راديو صح؟ مزبوط؟ على البلاك بورد كان موجود. فنفس الكونتنت تقريبا بدل ما يشرحها الدكتور عبيدين شرحها الدكتور أحمد. we'll go over that إن شاء الله. Okay? طيب. Short introduction. This is a recap to last year when you guys took in MSK. When we talk about يعني imaging, especially X-ray, air usually appears as black, and then as stuff gets denser, it gets paler. Then we have metal, bone, and fluid, which is contrast. They all appear as white. Okay, fat appears something here in between, appears as soft tissue. Okay. So always when we, especially here, it's mostly chest X-ray and abdominal X-ray, there is always bone in the picture. So we have that in our mind as a reference, okay? Because bone is white, that we use that to assess nearby structures and how white or dark it is. This will help us in diagnostic. Type contrasts basically, if you guys have heard, barium meal, patient takes this actually, takes this and drinks it. And this is useful, helps us in visualizing hollow structures, okay? Any hollow structure in the body, whether it is the alimentary canal or the vessels or whatever, we put contrast, which is a fluid in it, appears hyperechoic or appears pale on X-ray, and that helps us to visualize if there are any defects in it. That's how it appears. This is the first gulp. Okay, first lecture, which you guys took. Type. Does this appear familiar? If anyone has an idea, what is this? GI, yeah? Only GI.
Stomach.
Okay, high esophagus, high stomach. How did we know it's stomach?
Because it's the shape and material.
What is it called? لهم اسم. Rugae. Okay, the rugae is of the stomach. This image is actually, hernia, exactly. How do we know? This is the esophagus. Okay, the image is not really clear. This is the esophagus, and in this image, the diaphragm is almost here. Okay, same thing here. The diaphragm is here. This line and this arrow shows the diaphragm. Okay, مثلا هيك تقريبا. تمام. طيب, types of hernia. You guys took week 3, I think, or week 2. Sliding. Types of hernia. What do we have? Type 1.
Sliding.
Sliding. Type 2.
Horizontal. Or rolling.
Okay. Type 3.
Mixed.
صح مزبوط. طيب هاي أي type؟ بس هاي type 1 أيوة اللي هي بس what's herniating? The gastroesophageal junction. Okay. I have a drawing that will show. Yeah, sliding type 1 hernia. These are the rugae of the stomach. Shows it. And the types. This is what? Which type? Sliding. This one, again type 2, paraesophageal. Then you have mixed. This type 4, but it's not really needed. Then we have this image similar to the previous one. Okay. This is what type?
2.
Type 2. ليش؟ في جزء من الستومك طالع لفوق. مثل ما انتم شايفين الكونتراست لما نزل لتحت اتجمع فيه. فهمت كيف؟ هاي مش الgastroesophageal junction. It doesn't widen up like this. This is part of the stomach. Okay. Yeah, same thing here. Again, this is the esophagus. Actually, this is. Now wait. Never mind. Okay. هاي عندنا الاسophagus هون تقريبا. تمام. أو الاسophagus هون عفوا. هذا الdiaphragm. We have a part of the stomach that's above it, but the gastroesophageal junction is intact. This one. Yeah, left is mixed hernia. لأنه هاي junction فوق والstomach مع بعض الاثنين. أما right is type 2. The gastroesophageal junction is below the diaphragm. Should be basic. Okay, طيب what is this? لا تجاوبوا هنية بس which organ is this? أيوة. What's the point of putting this image here? The point is, even though the stomach doesn't appear rugated in this image, but you can tell from the structure that's after it, this is the small intestine. Okay? So not always stomach appears rugated. Always يعني, keep the context in mind. You know the previous organ, you know the next organ. So you can make an educated guess in case an image like this comes in the exam. طيب, now for a few pathologies throughout. What does this appear like? What image? Or what organ? Esophagus. Okay. What can you see in this image? يعني roughly. Does it appear normal esophagus or is there something wrong with it? Ulcerations. Okay. This is an example of esophagitis, reflex esophagitis. So when you have GERD, acid comes up, goes up, irritates the esophagus, so it appears like this. Yeah, begins distally, thickened folds, may have associated linear ulcers. For the following images, يعني just have the image in your mind. Dr. Rami, alaykum salam wa rahmatullah. Dr. Rami doesn't bring theory, okay? He doesn't bring anatomy. Although he explained anatomy in his lecture, 30 minutes he was explaining anatomy, but Dr. Rami usually image and diagnose, okay, with a small vignette. Okay, what does this appear like?
This is hernia.
Which organ is this? أو مبدئيا esophagus. حلو تمام. شوفي تحت. esophagus عادة بيكون هيك هاي وبعدين بيضيق تحت. Structure. Yeah, very basic. This is a benign structure. Usually distal or the mid esophagus. يعني the first part of the esophagus usually doesn't. In case of a benign structure, there are other pathologies. طيب, what about this? Again, what organ is this? Okay, esophagus. شوفي عنا هون. لا, web isn't tight like this. Think طيب. Structure بس يعني worse. Something worse.
Adhesion?
Tumor. Tumor is a good guess. It's esophageal cancer. يعني I doubt he will bring stuff like this. Usually he doesn't, but I had to include them just in case. Okay. طيب هاي. اوكي هاي بدها حنكة شوي. طيب هذا شو هذا الستركشر شو؟ لساتني اسوفيجس. هي الليكتشر هاي اسوفيجس في الاغلب. طيب هذا الاسوفيجس. هاي شو هاي؟
I think this is the plexus.
شو؟ يعني قريب. This appears like the bronchial tree. bronchial tree من ورا. طيب شو بيوصل ما بين الاثنين؟ فيستولا. بالضبط مثل ما الشاب جاوب. ايوه بالضبط. تمام. This is esophago-bronchial fistula. تمام. طيب هاي لساتنا esophagus نفس الفكرة. تمام. This is a disease that you guys didn't take. يعني you didn't take this in pathology. بس a very easy way to recognize it in radiology is that esophagus, most of the pathologies we took are strictures, right? Narrowing. When you see widening in the esophagus, think scleroderma. This is the only differential in Dr. Rami's lecture that has this, which is a widened esophagus. Okay? Basically, this disease, you have sclerosis or calcification in the esophagus. Okay? Some parts, this affects the muscles of the esophagus. You know, esophagus is it's a flexible tube, contracts and relaxes simultaneously at different parts. تمام؟ بصير مشكلة بسبب الديزيز هذا. يعني التفاصيل مو مطلوبة منكم, ولكن بصير مشكلة في المسلز, فبالتالي it doesn't narrow as it should. It stays open, stays patent. Okay, when you see esophagus that's dilated, think scleroderma. Okay, this is for your own information. بعدين طيب this. يلا جماعة, this is يعني إذا في شغلة رح تجي على الامتحان هي هاي. أكاليزيا بس بالضبط. طيب هاي شو اسم الساين هاي؟ بالبيك ساين. خلاص إذا في يعني صورة واحدة بس تاخذوها من الجزء تبعي هي هاي بس. تمام. طيب this pathology.
مش ميكلز تبع كده.
لا ميكلز تحت. زنكرز. طيب زنكرز ليش؟ Outpouching. Okay. Fair.
And it's high up.
And it's high up. Basically, again, the idea of the contrast. Contrast goes down the canal. When it sees a pouch, collects in it. That's why the pouch appears hyperechoic here. Very basic. Okay. يعني هو in our year he said skip تمام بس I included it in case it's very distinct, it will be useful later on. يعني you can't graduate as a doctor without diagnosing this. طيب هاي الصورة
Much better.
يعني what pathology؟
It is
زنكرز. لا هي زنكرز نفسها بس الصورة الانجل اختلفت بس. حتى لاحظ هي مو سيمتريكال لانه اذا بتشوف الريبز مايلة شوي مشان هيك appears يعني appears wrong بس it's also زنكرز. طيب this is what modality is this؟
CT.
CT اوكي. طيب شايف هاي؟ ايوه هي هاي الزنكرز in this case again but it's hollow لانه out pouching تمام ف appears like this. This is also Zenkers. Again, Zenkers here, if you can see. Same idea. This is X-ray without contrast. That's why it appears black. طيب, this is the first lecture. Now the second lecture, this was given in our year. You guys didn't take it. بس يعني you took it dispersed throughout OSCE sessions. So I'll go over it quickly. It's easy يعني few basic points. Okay, this image is all over the place. طيب, this is actually normal, okay? There's no pathology in it. But when this part, I'll mostly be explaining the intestines and the bowels, okay? So for the bowels, two important concepts to know. Large bowels are usually distal, peripheral or towards the center. Large bowels are, on the sides, as you guys know. طيب, what specific distinct anatomical, something very distinct about? Hosteras, exactly. In the small bowel, they're usually inside, medial, okay? And they have, not hosteras, what do they have? What is it called?
The other one.
Plica circularis.
Ah, yeah.
You'll need this in OSPE more than radiology. يعني I'm going over this just for your own information, but in OSPE you'll need it, okay? فهاي الباترن, تمام؟ طيب نفس الفكرة, ما في شيء هون. طيب بس a small idea, if you can see, this image, okay? طيب, usually in patients when they come and we suspect a bowel condition, we like to have them standing, and we'll take the X-ray standing rather than lying down. Why? Because if we think of the tube like, if we think the tube like this, okay, there's usually fluid in part of the tube, intestine, تمام? High cross section هيك, تمام? If they're standing, the fluid goes down, air goes up, okay? There's a specific sign that you'll see in one of the pathologies, small bowel obstruction, where we have air fluid levels. Remember in last semester, RESP, air fluid levels? Abscess, something similar here, okay? When the patient is supine, this doesn't show up. However, when they stand up, it shows, and this is very distinct for bowel obstruction. Okay. فهاي الفكرة. طيب, can anyone think what appears abnormal in this image?
You have air under diaphragm maybe?
Yeah. طيب, هاي air under diaphragm هون. تمام. Is this pathologic?
No.
Why?
Don't.
Yeah, because the stomach has air. It's not always filled, especially near the upper part, fundus I think it's called. Okay? But this is normal. Usually when you have air under the diaphragm, on the left side, this is physiologic, because you have the stomach there, which has air normally. Okay? However, it's when air appears on the right side, it's pathologic, which is this small pouch here. Right? Okay? It's called pneumoperitoneum. But this is, although the image appears normal and it's very subtle, but you need to catch this. This also can come in the exam. This is very high yield to know. Okay, it's usually emergency. طيب, small question for you guys. What can cause pneumoperitoneum? Perforations. طيب, another cause.
Ulcer.
ulcer perforation no. أيوه. Usually, تفضل. Trauma, exactly. Usually after surgeries, it's normal for patients to have pneumoperitoneum, okay? So it isn't an emergency. But if a normal patient who has ulcer then develops symptoms of pneumoperitoneum, which is usually fast breath and pain, then it's an emergency. Okay, طيب can anyone tell me where the diaphragm is here roughly if you can see it طيب
It's the way down.
هون هيك لا هاي
No,
الربس
it's the, yeah.
this thing
Yes.
طيب وهاي الجاب هون
Air on the diaphragm.
yeah air under the diaphragm. This is basically a pathology in this case. Okay. It's a bit tough to recognize in this image compared to this image because the patient has other pathologies. تمام واضح إنه في device هون ويمكن عنده heart failure أو شيء. تمام. It's difficult to recognize. بس always keep your mind on the diaphragm. Okay, and you'll be able to catch it إن شاء الله. Okay, هاي نفس الفكرة. طيب. I'll come to bowel obstruction. لا هون. Okay. فهي نفس الفكرة شرحتها قبل شوي. In supine, this patient has bowel obstruction. These are two different images. One is supine, lying down. The other one is erect. Okay. When the patient is supine, it doesn't appear that much. When the patient is erect, it appears, which is small bowel obstruction. Could be mechanical or ileus, اللي هي usually after surgeries, when there's paralysis of the intestines. Okay. What happens is that the intestines are always يعني every second they're contracting and relaxing to propel food along. Okay. If this doesn't happen, you have the solid, it accumulates down and fluid ascends up, so it forms this distinct sign, and the lines of air fluid levels appear. Okay, that's basically it. Very very simple. طبعا in this case, this is small or large intestine. This is small intestine. Why? It's in the center. And there's like a circularis as well, as unlike the large intestine. We'll come to see it now. طيب this image أي وحدة هاي small bowel or large bowel? large أيوة هاي مثل ما أنتم شايفين هون hostoras are incomplete lines يعني it's distinct here on the side but it fades as it goes medially, unlike this image here. Yeah, this image, if you can see here, having the parts of the intestine as prominent, this is a sign of bowel obstruction. Okay, so here the hostoras are prominent, here it's small bowel here in the middle. Okay, it's not really clear in this image. طيب, okay. That's it for bowel obstruction. So far we took esophagus, we took types of hernias, a few differentials for esophagus, and bowel obstruction. طيب, can anyone guess what this structure is? We're still in GI. Gallbladder, okay. And this? طيب, if someone was to say this is a tumor, how can we say they're wrong?
The opposite.
This part, right? The shadow. This is why, because stones are opaque and they're thick, and they're not a part of the normal person's cells. Okay, so they cast a shadow when ultrasound hits them. Okay, unlike a tumor, it usually doesn't unless it's calcified. You can also see in this image, this is it's the same patient in both sides. You can see two calcifications or two dots on X-ray, which are the two stones here. Yeah, gallbladder. Okay. طيب, again, this is the same idea. هي الفكرة تبعتها. تمام? When ultrasound hits and then goes back to the probe, there's some issues in the waves coming back. Okay? That's why it appears like this.
الصورة اللي قبلها كانت شو؟
نفسها. ما هذا هاي الستون هون وفي شادو هون. تمام؟ باقي التيشو لا. اوكي ما في شيء هون. طيب, this is a few يعني they're different, okay? Not all of them are GIT, بس يعني you should be able to recognize them, consider them as a quiz. I don't think this was in the OSCE, but we took it last year, that's why. طيب, what do you this is year one stuff. What can you see a problem here?
Fracture.
Okay, fracture. Which vertebra?
It's L4.
طيب, هذا شو؟
Lordosis?
لا بس هذا ايش؟ What organ is this? Or what? This is the sacrum, right? This?
This one, the L4.
لا, L5. 5 lumbar vertebra. هاي هون يا زلمة. هاي هون مقسومة بالنص. ايوه هاي L5 fracture. اوكي نفس الفكرة هون. This is a different image. You can see the L5. Okay, it's split. It's you have L4, L5 and then the sacrum. Okay. تمام.
في شيء اهم واضح كثير.
وين؟
شوفوا قدام الفرتبرا. شوفوا
في ابيض في حصوة.
شو الابيض هذا قدام الفرتبرا؟ This is calcification of the aorta.
هاي؟
مش هاي الواضحة، الثاني واضح أوضح كثير.
وين؟
Go in front to the other picture. هاي بالضبط هاي كلها.
هاي اوكي.
This whole thing is the aorta. These are the walls of the aorta calcified. There's also another finding. Okay.
اوكي. طيب this is يعني we took it last year. It's not really important بس يعني it's nice to know. طيب أول شيء what modality is this? Modality X-ray CT. This CT. Okay. This is transverse. تمام. هاي شو؟ هاي هون. Spine vertebra. So something is coming from the back as you can see. Injury. طيب أو stab wound. Okay. بس due to the nature of this because it's straight يعني usually stab wounds they come at an angle. Okay. So this is a needle. It's just a needle going inside. Okay, it's not really important بس يعني we took it last year. طيب. Can anyone guess ليش هاي الصورة هيك؟
في ستونز.
اوكي جميل. طيب في هذا شو أول شيء هذا الأورجن شو؟ بانكرياس. طيب تمام. Pancreas, what pathology you took for the pancreas? Pancreatitis, yeah. It's chronic pancreatitis. That's why it's calcified. تمام. Chronic inflammation triggers calcification. Okay. This image is يعني ما أعرف ليش طالع هيك ولكن في calcifications هون. تمام. لما بعت لكم الباوربوينت حتشوفوها. في calcifications هون منطقة البنكرياس ومن من السي تي it's clear إنه في calcifications in this organ that spans like this. Okay. طيب few cases and I'll be done إن شاء الله. هاي إيش كانت هاي؟ أوكي طيب نبدأ. أول هذا شو؟ هذا هيك. دايفرام. أوكي طيب تمام. طيب دايفرام عادة هيك empty. Pneumoperitoneum. أوكي. Pneumoperitoneum I think that's the diagnosis.
فحس في عضاء غلط.
هلا هو الصورة شوي الصورة يعني مو أحسن شيء. تمام. بس هي الفكرة إنه أظن هرنيا والله أعلم. دقيقة بس خليني أشوف. أيوة هي الهرنيا بس هاي الفكرة إنه في هرنيا هون. أوكي. إنه we said what did I say? Okay. Left diaphragm here and then there is air under it. Okay. هاي المنطقة هون تقريبا. طيب. Think. If you can read as well. سريع أنت ما شاء الله. طيب diclofenac predisposes to what pathology? GIT. Ulcers. Yeah. Ulcers. Sudden sharp severe epigastric abdominal pain, probably perforated. Okay. Comes with this as you can see here. Okay. High diaphragm. High pneumoperitoneum here. هاي شو؟ Achalasia. Very distinct. تمام. طيب هاي bowel obstruction. Which bowels? Large or small?
large. فيها ulcerations
وين؟
على البطن.
طيب large intestine عادة هون هيك. هاد شايف شيء؟ بعدين large intestine is less in number. يعني كطول أقل. تمام. This is small intestine. Okay. You can see here it's medial. Mostly يعني. تمام. طيب this is an image that was in our year. Not really required for you. This is basically طيب هاي الهارت صح؟ تمام. This is from the side. هاي الهارت. What tube do we have that goes like this? ايورتا اوكي. اسوفيجس يعني هو الايمج صايره من طرف، اسوفيجس صار ورا تمام. فهاي الايورتا هون، وبعدين جزء منها you can see the aorta coming down like this disappears and then a small pouch appears here. Okay, aneurysm exactly, abdominal aortic aneurysm. طيب هاي نفس فكرة هذيك.
وين الايرتون؟
هاي لاحظ هذا الهارت تمام، هاي من الطرف، هذا الليفر هون تمام. هاي بداية الايورتا هون لما تطلع هيك تمام، وبعدين اختفت، وبعدين في عندك ماس هون هيك which appears pale white. This is a image with contrast.
السيرير صح؟
ايوه لا مو بستير، هاي من الطرف coronal section هيك، لا مش coronal sagittal sagittal ايوه تمام. طيب الهارت عادة في السي تي it appears white or black. Usually heart appears white or black. Usually the heart appears as black because it has fluid and the fluid is moving. تمام. We said fluid is black at the start. تمام. In this case the patient was given contrast, that's why the heart appears white. تمام. So when we see this, when we see the heart appearing white, any blood in this image will most probably appear as white. That's why we have the heart appears white, and then we have a white thing here which shouldn't be there يعني normally, which is again abdominal aortic aneurysm. نفس الفكرة باختصار. تمام. بس that concludes my part.
Unit to the repro unit. الريبرو you didn't take it بس الرينال you did. الرينال كان موجود معكم بالميد يونت أول واحد.